Well, hi everybody. My name is Mary Coughlin and I am the Chief Transformation Officer, President and Founder of Caring Essentials Collaborative. And it looks like you liked my video that I did yesterday about an overview of trauma-informed care. So today I thought I would do an overview of the core measures for age-appropriate care. The concept of core measures originates from the Joint Commission and other quality conscious organizations that back in the turn of the last century, the late 1990s into the early 2000s, this consortium of quality-minded individuals came together to identify that there were significant gaps in the quality of services that were being provided in hospitals across the United States, despite the fact that there was available evidence to suggest that there were best practices around specific diseases that would reduce morbidity and mortality. And so what they did is they identified a series of core measure sets across a variety of high mortality conditions. For example, myocardial infarction, heart disease, community-acquired pneumonia. Those were the original ones. And since that time, with the burgeoning of new evidence and new research, they've created more core measure sets, again, specific to medical and or surgical conditions or diseases with a focus on reducing death and adverse outcomes. When I got to work with Sharon Gibbons and the late Dr. Stephen Hoth to create our original paper about the core measures for developmentally supportive care, we began our work with the understanding of the idea that we could create core measures or sets of attributes and clinical criteria that were evidence-based that would guide the clinician in providing consistently reliable best practice in developmentally supportive care. The thing that we loved about what we had created was that these core measures were disease independent, that the core measures for developmentally supportive care and subsequently age-appropriate care were relevant for you, whether you were a premature individual born at 23 weeks gestation and had respiratory distress syndrome, or if you were born at 32 weeks gestation and you had some other type of pathology, or even if you were critically ill at full term and maybe had some, either a diaphragmatic hernia or some other medical or surgical condition. The diagnosis in and of itself was irrelevant, that these were care practices that were evidence-based, aimed at serving the human dimensions of the patient population that we serve. So we were really excited about this, and we entitled the paper Core Measures for Developmentally Supportive Care, Theory, Precedence, and Practice. We identified, after we did this amazing lit search that was really amazing and overwhelming, we organized our results into 5 categories. These were the 5 core measure sets to include the healing environment, pain and stress, protected sleep, activities of daily living, and then the fundamental core measure of family-centered care. Since that time, we've been able to do several updates to the core measure sets as more and more evidence and information becomes available to us, although the core measure categories remain the same. There have been other researchers and authors that have explored this idea of core measures, and I'm sure you're familiar with the core measures for neurodevelopmental care by Phillips and Altemeyer, and they've identified 7 core measure sets. Truth be told, it's the service or the offering that resonates best with you, right? I think it's wonderful that there are so many people passionate about developmentally supportive care, trying to adapt it to what fits good for them, what feels right for them. It's I think of it almost as Baskin Robbins is a famous ice cream shop here in the U.S. I don't know if they're still in business, but they had 31 flavors, and it's about picking the flavor that works best for you. As long as you're providing evidence-based care, as long as you're providing it with authentic healing presence, you're relationship driven, then it doesn't matter if you use the original core measures or you use the 7 core measures or you use whatever model that resonates with you. It has to feel authentic to you in order for you to deliver that level of authenticity to the patients. So what I thought I would do over the next couple weeks is give you a little video blurb introducing the different aspects of each core measure. And please, as I post these, I want you to shoot me some comments below and say, yay, nay, got some questions, or please stop posting all of these crazy videos, okay? So I want to thank you very much again for your interest in this work, and as always, take care and care well. Bye.